Hi, good afternoon everyone. Welcome to today's event. I'm Meredith. I work with the Honda Center for Human Rights and International Justice. For those of you that are familiar with us or those that may not be, we are a center on campus that offers the minor in human rights, as well as student internships and a full slate of events. So we're excited to have you join us today on Halloween, no less. So while many of you are having fun today and thinking about tricks and treats, there are some actually scary things happening in our environment today. And the current political climate has really triggered a lot of political advocacy and activism, both at the local, national, and at the global levels. And I think it's really important. It has always been important, but particularly now it's more salient for people to want to be able to identify if what they're doing is effective. There are a lot of campaigns that you see out there, whether they're through emails, through online campaigns, meeting with Congress people. But one of the biggest questions is, how do you know if what you're doing will achieve its impact? And so today we have two very special guests, Dr. Annette Gardner and Dr. Claire Brindis, who have just published a book. There are actually postcards on the table. We don't have the book for sale here, but you can purchase it on Amazon or it's through Stanford University Press, who are talking about evaluating advocacy policy change. And they're talking about real issues, concepts, tools, case studies. And they're going to run us through that today. So first I'd like to introduce our speakers, allow them to present, and then we're going to leave enough time for some Q&A and discussion with all of you afterwards. Dr. Annette Gardner is an assistant professor in the Department of Social and Behavioral Sciences and the Philip R. Lee Institute for Health Policy Studies at UCSF. A political scientist, Dr. Gardner has designed, directed, and served as an advisor on national, state, and local research studies and evaluations, primarily focusing on expanding access to health care, insurance coverage expansions, the adoption of health information technology, and expanding advocacy capacity. She was the director of an 8-year evaluation with the California Endowment's Clinic Consortia Policy and Advocacy Program. She's also the director of the Institute's Evaluation Community of Practice and is co-author of the new book, Advocacy and Policy Change Evaluation, Theory and Practice. And to our left is Dr. Claire Brindis, who I had the pleasure of working with over a decade ago and was really excited when I saw this book came out and reached out to Claire and said, please come bring your expertise and your knowledge to Stanford. Dr. Brindis is a professor of pediatrics and health policy and the director of the Philip R. Lee Institute for Health Policy Health Policy Studies at UCSF. She's director of the Bixby Center for Global Reproductive Health and executive director of UCSF's Adolescent and Young Health National Resource Center. So as you can see, our speakers are very busy, so I'm glad they took time out of your work to join us. Dr. Brindis incorporates a variety of qualitative and quantitative methodologies. She focuses on program evaluation, translation of research into policy, particularly in the areas of children and adolescent health and women's reproductive health. Dr. Brindis has special expertise on Latina diverse populations, global reproductive health, and migration and health. She has served on the steering committee of the University of California Global Health Initiative's Center for Expertise on Migration and Health, and the Center of Expertise on Women's Health and Empowerment, serving as a liaison between those groups. So I'd like to welcome our speakers today to share your insights. Thank you.
So Claire and I are delighted to be here today to talk to you about assessing activism, which is also referred to as advocacy, so I'll probably use the two terms interchangeably in these dynamic times. And we'll go a little bit into that. Thank you to Meredith and to the Honda Center for Human Rights and International Justice. We are honored to have this opportunity, and thanks for lunch. So let me just check in to see who we have in the room. How many of you consider yourselves an advocate? Raise of hands. All right. Just call out some issues that you advocate for. Yes.
Child brides.
Okay.
Against, not for.
Well, okay.
Criminal justice and anti-trafficking.
Okay. Others?
Voting rights.
What is? I'm sorry.
Voting rights.
Voting rights. Excellent. Excellent. Yeah.
Farm workers.
I'm sorry.
Farm workers.
Farm workers.
Farm workers. Great. All right. So that one's an easy question. Okay. How many of you do evaluation? 1, 2, 3. I this hand signal is very informative. All right. Well, we can help with that a little. We'll see. And
Does
then
my wife's critique of my performance count as an evaluation?
we call that assessment. Now, did she do it on an ongoing basis?
Very regularly.
We call that monitoring. But it's all in the name of learning, okay? And that will come back to that too. That many times we think of evaluation in somewhat old-fashioned terms, which is it's about accountability. Did you do what you said you were going to do? And if not, that's a failure. So we're going to talk about it in less charged terms than that, which is how do we learn from this and improve what we're doing around advocacy. Okay, so today we're going to explore the intersection between advocacy and evaluation. Claire's going to provide an overview on advocacy and policy change, and then I'm going to discuss how funders, advocates, and evaluators can learn what works and what doesn't, aka evaluation. So, Claire.
So I want to add also my thanks to all of you, and Meredith in particular. It's wonderful to see you and have an opportunity to share with you some of our findings and really give you an opportunity to learn more a little bit about our project, which is our book project. And a great deal of what we were attempting to do is to bring the science of evidence to the field of advocacy and policy change. Because there's a lot of activity out there, but we don't know which of the techniques are the most effective. So in order to create this book, and I have to really acknowledge and thank Annette for her wonderful leadership and really major contributions in the way that this book came out and was produced. But we were very ambitious. We were very aspirational about really wanting to change the field so that as people try to figure out how to best advocate, that we provide them with some of the tools, some of the models, some of the instruments, so that it'd be very handy and at their fingertips. We also wanted to use a variety of case studies as an educational approach, and one of them, Annette will be sharing it with you today. And we also did a survey of those individuals who are evaluators of policy and advocacy efforts in the field to find out where is the field, what's going on. And we wanted to really strengthen the link between scholarship and advocacy, the public policy arena, the nonprofit sector, which is often involved in this arena, as well as just the idea of evaluation practice, so that all of us, whether you're an evaluator or whether you're an advocate, are learning about how to be most effective. And frankly, we really wanted to advance the field. So the major push for us was evidence-based. We really wanted to say, where is the field, where's the field of science, and where are we going? So, did I go too fast? Oh, okay. So as many of you know, this is an amazingly turbulent time in the United States and across the world. And really, honestly, when we started writing this book, we did not anticipate that it would be coming out in this era. In fact, I'm sure that your closets have been impacted by the time that we live in. I'm going to show you how my closet has been impacted. First of all, here is a hat that many of you may have worn. Some of you may have this sweatshirt of the it just says nasty woman, but also the last prop is Stand Up for Science. So Stand Up for Science came along with the March on Science that happened earlier this year. And at UCSF, we actually had a sit-in. We had a science sit-in to talk about a panel comprised of individuals whose research and evidence has come in conflict with policy. So maybe later you can tell us about some of the new clothes in your closet. But we really wanted to figure out what is advocacy, how does it function, what are its many aspects, and this word cloud really picks on some of those wonderful terms, aspirational terms of what advocacy aims to do. It really is around social betterment and empowerment and human rights and equity. All of those are parts of what we were hearing about some of the special interests that you all have, and it's a really important opportunity to make a dent and to learn about how to be even more impactful in this very complicated world. Some of you may not be able to read this, but this is part of the survey results. And when we shared and asked people who are working in this area, we asked them, what are some of the tactics? What are some of the strategies that you're using? And I'll just give you sort of the four bigger ones. One is mobilizing citizens and organizing advocacy allies. Another one relates to expanding public and policymaker awareness. So if you're going to make any change, you really need to understand how to educate and communicate with policymakers. And then one other major area is researching and monitoring policy. Some of you may not think about that as a type of advocacy, but regarding that element of researching and monitoring policy is the data-driven, is being able to understand what is the impact of childhood marriages, or what is the impact of trafficking on young people, or what's going on with individuals who are working in agriculture and who may be having challenges with their health or their economic status. So we want to know what they've been doing, and what this survey really pointed out also is the fact that many previous funded projects was more upstream, pre-legislation or community organizing. And this reflected a moment in history when some of the foundations who have really been instrumental in paying for this work were really focused on those areas because they felt that they may not be as restricted as a private foundation. Now, why do foundations pursue advocacy? It's because they want to have a bigger impact. Yes, they can continue to fund community projects, but where you can make the greatest dent is where you really have an impact on either formal policy, which is a capital P, passing of legislation, or informal policy, which are those practices and procedures that you use to operationalize some of the legislative action. Now, over time, we've been seeing that the field has been focused more on evaluating legislative and post-legislative advocacy action, because many of these activities really fall within the domain or the discipline of political science. It's a discipline that really is focusing on how do these actions impact societies. Interestingly, some of the areas that have not been well evaluated are things like voter outreach or protests or even demonstrations. I'm sure that there are political scientists and sociologists studying the March on Science or the March in Washington and across the country on women, or many other of the activities, whether it's environmental, health issues, or other types of political action that are taking place in today's world. So when we talk about policy and policy making, here are some takeaway points for you about what we're really talking about. We recognize that achieving a system-level change to improve social and environmental conditions does not happen overnight. No matter how altruistic or how optimistic you are, much of the policy action and much of the advocacy action has to recognize the length of time it will take to make a dent in the concerns in the areas, because these topics are extremely complex. If you look at, for example, healthcare reform, part of the reason why this is such a controversial area is because there's so many different nuances, so many different issues that need to be dealt with. And the second area is that we have to understand the political context. We have to understand how an election can really matter in the way that things and issues are framed, and the way that advocacy and the way that evidence is used. And so part of it is having the evaluator in you understand under what circumstances are you trying to make policy change. What might be more feasible to do today versus having a 5 or 10 year longer timeline for you to think about. Not to get discouraged, because now there is a science. There are foundational theories of change that you can be considering, and I'll be sharing some of that with you. There's a whole body of advocacy and policy change evaluation practice on which upon you can draw. So there are resources. We do not want you to be discouraged. In fact, we want you to be charged up about doing it. So the reality is that we are looking, and we are both committed through our work and through our publication to really expand APC evaluation capacity, so that when you walk away today, you might be thinking about what kinds of situations you're in, what kinds of issues you want to make a dent in, and to really think about how we can improve upon it. Oops. So in this cartoon, you see the wrench, which is the evaluation tool, and then you say there's a problem with the nut. So this really is a lovely example of some of the definitional challenges that have occurred in the field, the elements of trying to figure out what best tool to use under what circumstances and with which groups and with which issues, and to be thinking about what are the conceptual frameworks that are well suited for program evaluation when there's a greater degree of either stability or uncertainty. And we will give you more details as I hand this over to Annette, because she will be giving you some real concreteness around what are evaluation models and tools that have emerged over the last 15 years that you can use in the work that you're doing. So Annette?
So I might go dive into Claire's closet and see what else she has there. But truthfully, the key to success for writing a book, in fact, we learned a lot about writing a book in this process, is that you always have, it's important to have an excellent partner or co-author. And I just want to say that Claire has been the most excellent co-author I could have ever had. So the book is what it is because we were a really good team. So as Claire was saying, this actually was, for many years, the way evaluation worked in this arena. We really didn't have the tools. We have tools for program evaluation. Did a program improve health status? Did a program secure more financing? It really wasn't context appropriate. So we had to do a lot of tool building, and we were lucky that this arena had a set of players that have remained pretty constant through almost the last 20 years and dedicated to doing this. So I'm going to go through, and we're going to get a little bit into the weeds of evaluation here, and I'll touch base to see whether we've strayed too far. But one thing that's really important is to have a grip on how policy is made, both pre, during, and post-passage. So we have this lovely model that comes from the political science literature called the policy stage model, and not everybody agrees that this is the model, by the way. There are different theories on how we make public policy, be it based on groups and their dynamics, or in this case, a somewhat prescriptive stage process. But the stage process has been extremely helpful to help bring evaluators up to speed in understanding what is public policy. Much like that slide that Claire went through about, well, when we talk about advocacy, it always sounds like somebody with a bullhorn, and truthfully, I've never really seen anybody with a bullhorn. Most advocates are doing other things like testifying at committee meetings, or doing research, or calling your legislator. How many of us have been calling our representatives a lot more than we used to? And you call them on the first name, right? You're on a first name basis. So anyway, what other types of advocacy? Who's been marching a lot more than usual? Okay. How many people are sending more money? Okay. So this slide is to now kind of shift you and say, well, your advocacy in what sort of context around policy. And I won't read through all the stages. In fact, I'm figuring that most of you are familiar with this, maybe not all of the stages all at once, but just to say that we understand that policy can go through this somewhat lengthy, multi-step process of going from a problem that has to get large enough in scope and size for policymakers to pay attention to all these steps to both get it on the agenda, because it's a very congested policy agenda, to get it actually into formulating where you actually do your cost analyses to see whether these policy proposals will make it, and to the actual adoption and chaptering and writing into law and into implementation and the programs. So what we've done is take that very traditional stage model and help evaluators figure out what in each stage are you likely to focus on as an evaluation activity. So where do we have protest? We have problem recognition, where we have public engagement. So, and then what we do with our book is we tell you all the stages, what are your likely types of advocacy. So we're trying to create a roadmap to guide evaluators. And I can't stress enough that even if you're an expert evaluator, but if you're new to this area, you really need to learn these concepts and let them guide you in developing your design. If you're new to evaluation, it's still good to know that there will be some big differences in a typical program evaluation than a public policy or advocacy evaluation. So one of the things I want to walk you through and that I learned last week when I did a similar talk is having you think enough about evaluation. I'm going to try to keep this just to the most important points. But one of the ways that evaluators work, this is also very traditional, is that you first think about the inputs to your initiative. So we have a foundation. They want to fund a big media campaign to reframe, I should say, healthcare reform. Okay, why should the middle class be on board with a particular position? So you provide funding, you support a policy director and a nonprofit. You know, these are all the inputs that go into really funding advocacy and capacity. And then you figure out, well, what activities are you going to do? What do you use the inputs for in terms of activities? And I've got a bunch here that we've actually talked through a little bit already, but media, voter registration, policy forums, etc. Okay? Well, what happens? What comes out of those activities or outputs? Okay, and one thing, if you're going to do a media campaign, well, one of the things you need to do is have relationships with the media. Well, what is that relationship? Well, the optimal one is that the media calls you, okay, as well as you get your issues, your letters, your coverage in the daily newspaper, on the radio. Okay. Other types of advocacy could be training up your clinic patients to speak to policymakers, a board of supervisor about the role of the clinic in the community, so cultivating patient advocates. Sometimes an advocate is a newcomer to an arena, a nonprofit that's just hired its first policy director, and they want to be viewed as a credible source. Having done that research piece that Claire spoke to, where they provide the data on the number or percent of uninsured in a community or undocumented farm workers that require primary care services, that they can be trusted as a credible source. But why are we doing this? Okay, so this is actually a big aha, is that before you evaluate whether something works or not, you need to be clear on what was the purpose. What was the higher goal to that advocacy? Okay, usually it's about, as we said in the stage model of policymaking, you're typically going for policies and programs, and outcomes typically are framed or stated in ways that are aspirational. So policy and programs, not just a new one, but one that actually benefits the target population, communities, organizations, individuals, okay? And that is the way you need to rethink your advocacy. Is our advocacy really on track to achieve that, or is it going off in some direction just because we know how to do that? We've lost sight of the purpose. So I'm going to keep continuing and drill down a little around this outcomes piece, because it's a little more complicated, but I want to get you to the next step, which is, well, what's the evidence for showing that something works? Okay? Indicators. What are your indicators? Evidence, indicators, all right? And you want to strive for really taking a hard look at your advocacy and and figuring out what is it that I can document or count or observe that shows me that what we are doing is working. We can't just base it on a gut reaction or intuition or because we've always done it this way in the past. You really need some hard evidence. And there's a way to set this up. And again, you may not become evaluators, but you may work with evaluators. And you may want to have enough expertise to say, well, show me a logic model of how you're going and how that influences the design. And they'll know what you mean by a logic model, and so will you after I finish with this slide. So outcomes can be seen as short-term, intermediate, and long-term because time goes further out and things happen further out. And I'm going to walk you through a combination of an outcome and an indicator so I can really clarify what I mean by evidence. Okay? So say we want to we've got a new policy director at a nonprofit community health center that's never done advocacy before. They've got a policy director that comes in knowing how to work with legislators, knowing how to work with media. So they've really worked to expand that organization's capacity to do advocacy. How do you know this? Okay, well, on an annual basis, you can actually look at, through records and documentation, well, did the policy director target and work on these key policies that are important to our community health center, which typically are Medicaid and funding for services. So we can count policies and we can know how those policies played out, okay? So what if our loftier aim here is that our policy director really needs to increase policymaker and awareness of primary care clinic issues, which happen to do with providing services to a growing number of uninsured. How do we know that that policy director was successful? Well, anything that was targeted to a decision maker, be it a phone call or a policy forum where you invite your board of supervisors to hear about clinics, you can do assessment pre and post to see whether policymakers change their understanding, their opinion, their support. So you can gauge a shift in your policymaker. On a longer term basis, okay, and the reason I put changing policy longer term is that we used to throw around this number that it can take up to 17 years to see a policy win. But I was thinking healthcare reform is like a 40-year time horizon. I mean, the time horizons can shift, and it can shift whether it's the federal, national, state, local. A board of supervisors can pass a decision a lot more quickly than, say, the state or the federal level. And so how do you count? What's the evidence in that situation? Well, luckily, that one's an easy one. We know what bills are passed, vetoed, pending, and we know the dollars that are tied to them. So this one's kind of easy. It's hard to achieve, but easier to assess. And then, of course, you have your programs that the policies are supporting, and that one's, again, back into program evaluation, where you look at the program itself and its the extent to which it worked or not. And then what we also tried, and as Claire said, so much more evaluation is shifting downstream to what happened after a passage, not just to the program, a program being launched, but did the program achieve what it set out to do? And increasingly, in fact, we had this with our 8-year evaluation, is that we did have enough time in there to get through that policy stage process and into the programs that were funded or maintained, so we could connect the dots. But not every evaluation will give you this opportunity. For many of them, as Claire was pointing out on that slide, a lot of them have stayed under this short-term outcome or expanding advocacy capacity or increasing policymaker and public support. That is where the majority have been, okay? So we've got a really good idea that because we have all these evaluations, we have a good idea of the metrics, the measures, how to approach them, and that's what made the book a lot easier to write. So as I mentioned, some of the indicators that we linked to those outcomes, we have lots of sources, other sources that I didn't mention. You can actually look at media and count the number of times the policy issue is mentioned or where that coverage is. Advocates can do these things. Advocates can track at their end with a system, an Excel spreadsheet, how many times did a reporter contact me? How many times did my articles get published? did my op-ed get, I mean, all these things that advocates themselves can do, and never underestimate an advocate's ability to self-assess. You might have to work with them to set that system up, but, and you might have to convince them that this is a great idea, but this is doable. Like I said, you can actually go talk to decision makers, but truthfully, you should talk to their legislative aides, because they're the brains behind a particular policy. So you have to know how to access decision makers. Decision makers don't always want to go on record. You have to be very discreet. You have to understand that this is an arena where there is opposition. So not everybody's going to spill their life story to you about their tactics or their strategy, because they don't want to give that information away to the opposition. We do longitudinal surveys. You know, this is all conventional research and evaluation. We have done a return on investment because, like I said, a lot of policymaking is about the money. So we wanted to tabulate that to say, well, how much did this grant really pay off for these target communities? What's really great about this field has been very dynamic and entrepreneurial about developing tailored methods. And this is, I think, what's been so encouraging is that we now really have the tools. And I can't figure out what, if it's not a wrench, and okay, if we've got a peanut and it's not a wrench, what are we talking about in the way of a tool? Whoever comes up with that answer, let me know. But we have a much better tailored instrument to do evaluation because of all these metrics that I'm not going to go through, but you can see that I've got my outcomes across the top, and then we have tools and instruments and questions and types of analyses for each of these outcomes. So you don't have to recreate the wheel, okay? You just have to understand your initiative well enough, and then we have laid out a roadmap, and you just need to know, make good choices, probably with a partner. Let me know and I'll go on. Do you have it? Okay, great. So I'm going to give you an example of how this all comes together in a real live evaluation. And we had 6 of them for the book, and they were terrific. There was environment, this one's the tobacco one, we have health, we have forest conservation, we have federal, state, local, we have international, we have girls empowerment. I mean, just about any of the issues that you folks listed that you're involved with can lend itself to evaluation. It doesn't, there's no limits to the type of policy issue that can. So this one was in 5 tribes here in the U.S. Tribal, the training was of a community of well, they're evaluators now. They were trained up on how to approach their local decision makers around smoke-free casino policies, and then a very interesting issue about tobacco, because the cigarette companies have been targeting casinos because of their lax rules, and this has rippled out into the community. So how could this community reframe their understanding of tobacco, which historically had been more of a part of a ritual? So they've gone through a lot of discussion around that. But in terms of the evaluation, how did local advocacy capacity building influence decisions around smoke-free policies, public awareness around tobacco? What they did a rather ongoing, this is where, you know, I'll just, don't worry if you don't understand these words, formative and summative, which means process and outcomes evaluation. They were able to capture the real entirety of the program. They used a logic model with those outcomes. They were very participatory in their design and the way they worked with these 5 tribes. They're trying to inform learning about how this program is working while the program rolls out. Okay, they're feeding information back to the 5 tribes about how well their tactics are working. Did they get in to testify to their elders about a policy? Did signs get put up? How many people are still smoking cigarettes in a public activity? They could observe these things. And as I say, mixed methods means they did a real kind of cover the waterfront approach. They didn't just count, they interviewed, they observed. And then they were also very broad in their dissemination, or how do you use this information in terms of having 2-page issue briefs or community change stories, in-person meetings they found, or learning sessions. I mean, this is a very elaborate design, because many times evaluators don't have the luxury. They get caught coming in at the middle or the end. Okay, that is just a hard reality, but I do believe evaluation is making some strides in getting evaluation brought in early and often as a way to learn, inform, and change and improve as you go. So, one of our 6 cases, and again, just stepping back, if you may work with an evaluator someday who will have to have this slide in their head, okay, and there's a lot here, but once you do, and it actually doesn't take a long time to train up as an evaluator. UCSF and others are doing quarter-long and semester-long courses to get you going. If you've got a reasonable research methods background, then you're actually set pretty well to learn a lot of the concepts that are on this slide. This isn't rocket science. It's just a little, it is complex though. So all I wanted to point out though is a lot of things hold true in this arena of evaluation as in program evaluation, except for a couple of things, which is typically you'll see more quasi-experimental designs or non-experimental designs, because this is a hard area to have a control group or to have a large sample size, which is true in the research arena as well. The other thing that's interesting is that, as I mentioned, it's got all these different methods and tools or instruments to assess, so you can get really, you can fine tune and use a better wrench or whatever our alternative is. Also that there are some models for thinking about advocacy and policy change that are different than program evaluation, which is systems thinking. Okay, how do you deal with complexity? How do you map complexity? And systems thinking is really good for that. Empowerment evaluation a lot of this is about representation. And how do you work with advocates so that they are both learning out what they're doing is going well as how do they assess it and how do you do it together? Because again, what we see as one of the primary objectives of evaluation is to really strengthen advocacy as well as determine, did this initiative or approach work? Using your findings. So I mean, there's a lot of detail on the up stage of the setting up your design. At the end though, or even in the middle, I should say, there's what do you do with this information? How does it inform learning? And you want to be somewhat diverse. You don't want to just send a report back to a funder and call it a day, okay? In many situations, this is really about working with advocates. Now, we did this. I remember this. We did this with our 8-year evaluation. We turned around and talked to the advocates about our findings, and they blinked at us and said, so what? We knew that. And I realized we were talking to trained advocates, right? They knew how to do advocacy. And then I said, okay, well, what is it that we're not saying or we need to say differently to make this informative? And we had to have a dialogue about, well, what is advocacy? And it's not just one tactic at a time, it's a toolkit. You deploy your advocacy tactics based on where things are at in the policy making process, or what the terrain will allow for in terms of leverage points. But what we learned is that they needed to see data over time. That's what they had never done before. They'd never seen their advocacy rated and then displayed over a 5-year period. They'd not seen a return on investment analysis of their advocacy where they could turn around and say, wow, for our efforts, we really secured a significant amount of funding on behalf of communities. So, that was interesting for us to figure out, and luckily we had time to really craft that partnership and that learning community. Similarly with funders, sometimes they don't know what they want to learn, and so you have to be there to guide them. And also to think about it as an information feedback loop, that you're really trying to get some of this information back to advocates in a way that they can see if they need to do a mid-course correction. Are they expending resources on something they should not be? Okay, this is huge, especially right now, where there's just so much advocacy. How do you know it's being heard? You really can't afford to do things that aren't working. The other thing we strive for is that we, as evaluators, want to impart the ability to assess. That you shouldn't have to rely on an external bona fide evaluator to come tell you whether something's working or not. So we like to train up as we go. We handed all the workbooks and the tools over. Okay, and we did it gradually, not just all at once. So, and then the funders have been very active in this area since the early 2000s, and they have rather large portfolios in this arena, spanning multiple years. They really want to know, did it work or not? Because this represents a significant investment for them. In fact, some of our cases speak to that. They're multi-year, multi-country initiatives. So they have a big stake in learning what's working and what's not. This is an interesting one because what we're wrestling with is that because evaluation is now in this swirl of activity and turbulence, that you can't just hide below the radar. Okay, your information is going to be out there, but you have to be really aware that you are now informing the policymaking process. You have materials out there. So it may be very indirectly, because actually there's a lot of material out there. Whether you are really getting to decision makers, even as an advocate, is a really good question. All right, so I'm going to wrap up with the weedy part of the talk around evaluation as a tool to assess activism. And how am I doing? We're wrapping. So I have this checklist, which just reiterate to partner. Always partner. You need to be context aware and partner with everybody. You need to understand the initiative and the context. You can't walk in with blinders on or totally new to something. If you are, find a partner. You need to embrace the complexity as something you can deal with. You need to figure out how much of this is about saying, did an initiative work? And how much of this is about what can we learn from the initiative? Okay, but also you need to be clear when saying something works. In this arena, you need to acknowledge that there are other factors that contribute to a policy outcome. And this is why we say look at attribution that an initiative has. Also, as I said, you have a repository of resources, including the book. You always have to deal with challenges to rigor and being not just evidence-based, but good evidence-based. And also that you are really there as a voice to communicate and be in dialogue around your findings. Now, given the time, I am going to maybe just cut out the exercises. How much did you want to allow for Q&A?
You've got a few more minutes time to go till about 1 o'clock, if that works for you.
And do you
10
still
more
want to do
minutes?
Q&A after? Okay, so let's just do some call and response, just to kind of get into the mindset of what it means to assess advocacy. So say we have an initiative where we've decided our goal is to increase awareness of specific policy issues by policymakers, okay? This is our goal. So what are we going to do? We're going to host a policy forum for policymakers. We're going to invite them as well as the other people from our community. We'll call this a community event, the Palo Alto. Okay, it's going to bring in our folks from the medical school, from the county, from the clinics, to hear about the issue of the uninsured in this community. So, and making sure that the key board of supervisors and any representatives can attend and learn about the situation in Palo Alto. Okay, well, how do we have evidence that this policy forum worked? Okay, well, what we care about is, since our goal was to change policymaker awareness, well, we want to see a change in their awareness. Okay, we'll be really targeted to that. It's not always this easy, by the way, to come up with a good indicator, because some of this data is really difficult to collect. How do we assess it? Okay, well, why not just have a one-page sheet at the event with 6 questions asking about, did you understand this issue before you came into the event? How much do you understand this issue now on a scale of 1 to 5, where 5 is very much? What is it about this issue that you are likely to do? What is your position on this particular policy? You can ask this and get this information back, hopefully from everybody that attended, at least the policymakers. tabulate it, and it will give you a sense of how effective was this event in changing your awareness. Okay, second example, we're going to expand advocacy capacity. We're going to increase a nonprofit's ability to secure media coverage. Get articles in the paper that mention their facility or their issue, okay, or the target population. Okay, so we're going to do but to get that going, you're going to train up your policy director or your staff to speak to the media. Okay, clinic patients are great representatives to speak to the media because media doesn't want to speak to somebody, to a know-it-all. They want to talk to people who actually experience the situation, like clinic patients. Okay, so we'll train those patients to speak to the media. Well, what can we do in the way of the indicators here? What are what would be the evidence, the training of your clinic patients to speak to the media, so you know how to do an elevator talk or how to be very specific? What tells us that this has worked? Any suggestions? Go ahead.
Frequency of articles related to patients' interviews.
Okay, count whatever coverage there is. What if you don't get coverage? Well, plus, don't ever rely on one source of data because you might not get coverage. But it's good that you have that one on a list. What else could we add to the list?
Frequency of interviews, even if not covered.
The what?
Frequency of interviews, even if not covered. Patients said they were interviewed, but ended up making published.
Okay. Just even the number of contacts that you have, that they even get to talk. Other thoughts? Anything else that we're missing here? All right, let me show you what we did. Oh, okay, sorry, I just jumped ahead. And I think you can go into the media coverage. You can count by the number of times by just talking to the patient. How many times did you talk? Okay, but what did we do? We did case studies. We actually took this sense that we had this idea that we wanted to know what the training program was because nobody else is doing this. And then we actually if there was any media secured, we looked at that. And actually we also followed up and called where we knew the coverage was targeted. Well, I think we talked to, since it was local, we could talk to the Board of Supervisor aide about a particular event. So we could follow the whole process to all the targets and capture what the training looked like and what we thought they had achieved. So we're very broad on this one. So you can be that way, you can be very narrow, do a one-pager, or you can be very broad and take a full picture and see what comes up. Because like I said, we want to inform learning. Actually, people want to know a little more about how did you do the advocacy. So then they necessarily want to learn, did it work or not. But you've got to balance both. Okay, so I'm going to end on a positive note. That's what politics is, the world moving ahead. Only in politics the miraculous occur. And I don't know how many of you are familiar with Angels in America. It came out in the middle of the HIV crisis in the mid-'80s. It was a very dark time. And yes, we might feel like we are in that, and maybe we are, not feel like, in that dark time. But just to realize things change, and they can change very quickly, or not, but hold out hope that it will all work out. So thank you to you folks for attending and to our many partners in this book. We have great partners, not just our partnership, but we were well supported in our endeavors. Thanks so much. Thank you.